Hello all, today I'm going to be talking to you about the gestational breast cancer or pregnancy associated breast cancer. Breast cancer diagnosed during the course of pregnancy, 12 months after delivery or during any course of lactation. It is known as gestational breast cancer. What is the incidence of breast cancer during pregnancy? It is relatively uncommon. However, the incidence is on the rise because of advanced maternal age and because of the lifestyle modifications. Now, what is a challenging clinical scenario here is you can see that the breast cancer symptoms are similar to that of the physiological changes that take place during the course of pregnancy. So these symptoms are usually ignored and they pick up the symptoms very late, and so the advanced stage of cancer is picked up. And what are these symptoms that mimic that of a breast cancer and which are the physiological changes during pregnancy are pain in the breast, heaviness or feeling of lump in the breast, change in the color, size or the shape of the breast, or sometimes there could be a nipple discharge. Now whenever we are planning the treatment for breast cancer during pregnancy, we have to keep in mind the health of the mother as well as the fetus. Now, what are the other factors which decide the treatment of breast cancer during pregnancy is the stage or the type of the cancer and at what time it has been detected, what is the period of gestation when the cancer was detected, and what is the overall health of the mother. Now, what is the most commonest type of breast cancer that we see is the intraductal or the ductal carcinoma during pregnancy. Now, when we look into the assessment or how we draw a conclusion to breast cancer in pregnancy is we have three main types. You have the clinical criteria, you have the imaging modality and the pathological criteria. The clinical criteria, you take a detailed examination of the patient and you take a history as well, and then the imaging modality includes the ultrasound, mammography or the MRI. Ultrasound, it is radiation free, and ultrasound can be used to know the cystic or the solid masses can be differentiated. It can also be used as a tool for guided biopsies. Now, when it comes to mammography, it has got some amount of radiation, so there is a risk to the fetus. So always an abdominal shield has to be used while doing a mammograph. And whenever you're doing an MRI, you have an extended view of the particular lesion and you can know the soft tissue anatomy much better with the MRI. The gold standard for diagnosis of breast cancer is the FNAC or the core cut biopsy or the excision biopsy, which can be done. Now, what are the treatment modalities? It is to be treated just like any other non-pregnant woman, the breast cancer in any other non-pregnant woman. So you have to have the surgical intervention if required. If not, you have the therapeutic agents like that of chemotherapy, hormonal therapy, and of course the radiation. Now, does radiation and chemotherapy have an impact on pregnancy? Yes, of course it does. So what are the side effects? You have to explain to the patient that they could have miscarriages, they could land up having a preterm delivery with a low birth weight baby, there could be chromosomal or congenital defects in the baby, there could be restricted fetal growth. Sometimes you can also have an intrauterine fetal death, or even they could land up with stillbirth. Now, you would have certain questions like, is it possible to have a normal pregnancy after a breast cancer has been treated? Yes, you can have a normal pregnancy. Only when it comes to a surgical mastectomy or if they've had an radiation, the breast would go in for fibrosis. So lactation could be a problem in the subsequent pregnancy. And now I know the next question is going to be whether the person can have the chance of breast cancer during pregnancy. Again, the answer is yes. So no symptoms have to be ignored during the course of pregnancy. And breast cancer with pregnancy is a multidisciplinary approach where you have an obstetrician, a radiologist, a radiation oncologist, and you have an oncologist along with a neonatologist who's going to handle this situation in a prompt and in a very precise manner. And at the same time, you should have the help of a psychologist who can psychologically support the mother during the entire journey of pregnancy. Thank you.